We will go ahead and call our Thursday, May 28th meeting of the Rutherford County Benefits Insurance Committee. Unfortunately, my script is not here, which I'm supposed to read, but I'm going to wing it. Pursuant to Executive Order, whatever that number is, issued by Governor Lee, we are allowed to vote electronically. Does everybody understand that? Okay. My materials weren't here to read that, so at least we do have permission from the state to vote electronically and by Zoom. So, the chair will entertain a motion to approve the minutes of the last meeting.
Do we want to take attendance first?
I'm sorry?
Do we want to take attendance
Oh,
first?
yes, ma'am. I'm sorry. If you would please call the roll, Madam Secretary.
Yes, sir. Preble, Acton. Rhonda Allen.
Here.
Dr. Andrea Anthony. Dr. Andrea Anthony. Doug Bodery. Doug Bodery. Amber Brown.
Present.
Thank you. Shay Crowell.
Happily present.
Is Doug Bodery?
Thank you. Holly Deering. Holly Deering. Alan Farley.
Here.
Mary Hickerson. Lois Miller.
Here.
Alan McAdoo. Alan McAdoo. Jeff Phillips. Jeff Phillips.
Hey, Chris, can you come close my door? Yes. Sorry.
Shantae Sherrill.
I'm afraid it's going to be too loud. Present.
Shantae Sherrill.
Present.
Dr. Andrea Anthony.
She's here.
Present.
Go back and get her. Eric Tutabeni.
Here.
Mayor Bill Ketron.
Here.
We have a quorum.
We have a quorum. Well, thank you very much. The chair will entertain a motion. First, let me say, Jane, thank you for filling in today. Jane Corbin from Risk Management Office. We appreciate you being here and helping out in these times. The chair will entertain a motion to accept the minutes of the April meeting. Is there a motion?
This is Lois Miller. I move to approve.
Motion to approve by Lois Miller. Is there a second?
Second.
Was that second?
Who said the second?
Amber.
Amber.
Thank you, Amber.
Okay. All in favor of accepting? No, we have to call roll. Please call roll, please.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering. Alan Farley.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips. Jeff Phillips. Shantae Sherrill. Eric Tutobani.
Yes.
We have quorum. Yes.
Motion passes. Next, we'll call on Ed Elam, Director of Insurance and Risk Management, to give us a report on financials. Mr. Elam, you're recognized.
Yes, sir. In our year-to-date on the 264 fund, the revenue is $32,476,936, compared to the expenditures for the calendar year is $25,162,759, and the difference is $7,314,176. For the fiscal year, the revenue is $64,348,914. Expenditures are $64,446,360. And the difference of that is a negative $97,445. If you go to the tracker, you will see the employees for the month of April is 6,241. And the revenue for April was $6,983,798. Expenditures being $5,197,275, with a difference of $1,786,523. That's the 264 fund. The 266 fund, our OJI fund. If you look at the graph, you will see that we had a larger number of paid claims this year compared to last year. I will make a note down at the bottom that the county schools were closed for the coronavirus March 15th, 2020 through the end of the school year. County offices closed for the coronavirus April 2nd and through April the 30th. Now these were claims paid, and I'll keep in mind some of this will not show up until, as far as claims being paid, probably not till about June or July. You might see claims being paid lower than what they were last year because of the lower number of OJI claims. If you flip to the next page, you'll see that for the year 2020, we had $149,427.07 compared to last year at $104,589.26. Our year to date for 2020 is $551,864.64 compared to last year at $657,237.86. And you can see we're running about 84% of what we were last year. Well, I will make a note of this. The breakdown of the expenditures for this month of April, workers' comp was $79,449.78. OJI was $69,977.29. And that concludes my reports.
Mr. Elam has concluded his report. Are there any questions for Mr. Elam? Hearing or seeing none, if you would, Ms. Corbin, please call the roll.
Do you need to make a motion?
I do
Or we
need a
just call
motion. Is there a motion? Is there a motion to accept?
This is Lois. Move to approve.
This is Rhonda Allen. I'll second.
Motion and a second.
Right, thank you. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Bodery, yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Alan Farley.
Yes.
Lois Miller.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Mayor.
Aye. Motion carries. Next, we have item number 5 on the agenda, work comp and OJI report. Mr. Good, our safety director. Dan, you're recognized. Yes, sir. How are you, sir?
Afternoon. I'd like to report in the month of April, we had a total of 5 injuries requiring medical attention. That brings the year-to-date total for the calendar year to 52. Of those 52, 34 of them are OSHA recordable, and the breakdown for those are 22 are restricted days, 6 lost time days, and 6 all others. I bring your attention to the notes in the lower right-hand corner. The county schools have been closed since March 15th. This is through the end of the school year, which is this week was the end of the school year, so they've been closed since March 15th. That will account for some of the low numbers that you see for the month. In addition to that, the county offices were closed for the entire month of April, also from April 2nd through the 30th. As you look at the next page of the report, on the graph you'll see for the year-to-date, we have a total of 52 compared to last year when we had 87 and 91. And if you look at the April numbers where we had 5 this year, last year we had a total of 36, and the year before that we had 24. So you can see how the closing of the schools for the rest of the year because of the virus and the county offices, how that's affected the injuries. The next page of the report is the incurred dollars. The incurred dollars is an estimate of the expense to treat and close out the injuries. And right now for the year to date, we're at $149,000 compared to $172,000 last year and 2 years ago at $241,000. And again, part of this is due to the virus also and not having as many injuries. The last page of your report, we broke down where those injuries are across the county as far as the Board of Education. Of the 5, they had 2. Both of those were in the custodial positions where they were cleaning up and doing things in the schools. And the county government had a total of 3. And those 4 and the 3 were 2 in the Sheriff's Department and 1 in solid waste. That's all I have right now, Mr. Mayor.
Thank you, Mr. Good. Are there any questions on his report? Seeing or hearing none, is there a motion to accept the report? Is there a motion?
This is Amber. I'll make the motion to approve.
Motion from Ms. Brown.
This is Alan, I second it.
Mr. Farley on the second. If you would please call the roll.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Alan Farley.
Yes.
Lois Miller.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobani.
Yes.
Mayor.
Aye. Motion carries. Thank you, Mr. Good.
Thank you very much.
Next, item number 6 is a wellness update. Mr. Chapa, Signal Wellness Coordinator.
Thank you, sir. Can everyone hear me okay?
Yes, sir.
Alrighty. So I know it was voted to suspend the Motivate Me program and the incentive program and just credit all employees for this year. But that said, that system runs through claim validated. So basically, it'll continue to run and continue to pick up these numbers. And at the request of Director Elam, he had me add the 2019 numbers so we can kind of see a comparison based on how COVID may or may not be affecting individuals' ability to get out and be able to take part in some of these screenings. Also to see just general activity towards that. That being said, currently we're sitting at 888 annual physicals as opposed to 1,408 as of this time last year. Biometric screenings currently at 1,391 as compared to 1,377 last year. Health assessments, we're currently sitting at 343 completed in comparison to 516. Mammograms, we're currently at 571 as opposed to 615. OBGYN screenings, 879 currently, 951 last year. Colon cancer screenings, 263 versus 235. Cervical cancer screenings, 784 versus 884. Prostate exams, 253 versus 244. Flu shots, 1,873 versus 1,699. And totally goal completed, all individuals that would have completed their 3 points, 1,488 currently, as opposed to 1,703. So you can see some minor impact right now, but I would note that the heaviest time that we see people completing that time period is going to be the August and September months. So that'll be the major months that we can see the difference between the two. Moving into current and upcoming events, I'm currently working with St. Thomas Mobile Mammography Bus. We've got a few dates in August coming up, and we've reached out to the Board of Education to work at being able to set some of those sites up, as well as some for the county. And then we're also working on converting the traditional Wellness on Wheels, where we would visit all departments and all schools, into a digital component. There's a few more pieces of information we're trying to put together just to kind of provide a Q&A and the general benefit information, things like that, products and programs as well. But that'll conclude my report if there's no questions.
Okay. Any questions for Mr. Chapa? Thank you, Chuck. Next, we have the midpoint report. Shannon McNair.
Can everyone hear me?
Yes, ma'am.
All right, I'm going to share my screen. Can y'all see that?
Yes, we've got it now.
All right, so for our April report, first slide here, we're going to look at our total clinic visits. And again, just want to mention here that we really shifted mid-March to a virtual first approach. What that means is that we're screening all employees or all members, and if we're able to see that member in a virtual, telephonic, or video setting, we complete it that way instead of bringing them into the center to expose them, the transmission risk being there for our employees as well as your members. So for April 2020, we saw 670 total clinic visits. And below that, you see it broken down. We had 598 provider visits, and that's where you're going to also see on-site as well as those virtual, telephonic, and video visits. 52 medical assistant visits, that includes labs and injections. We didn't have any biometric only visits or any occupational health visits for the month of April. And we did have 20 wellness visits. And I did want to mention for the wellness, we did also transition to a virtual opportunity for them as well, so that they could complete the registered dietitian visits virtually without having to come on site to the center. Below that, you see our non-face-to-face encounters. We had a total of 849, still up a little bit from previous months like January and February. Obviously, we did more communication and outreach to the members, specifically surrounding those high-risk populations to make sure that they had the medications and that they were able to try to not come into the center to reduce their risk unless we really needed lab work or something to be able to refill those medications. The next slide here just breaks down our provider visits, and you'll see that our top visit type was the virtual visits. This is going to include our video and phone visits. We had 497 of those, and I just want to applaud Rutherford County's members. You know, that's never been a large visit type for us, but we've been able to work with several members, and I feel like they've gotten very comfortable with that, and we'll see that continue to stay up for the month of May as well when we do next month's report. We had 67 office visits, 4 annual physical exams, 4 sports physicals, and well woman exam. We had 1 of those. The next slide here is just our clinical quality metrics. If you'll look down at the bottom, it says 2020 year to date. So this is from January through April of 2020. So diabetes testing, this is capturing those that are attributed to us as their PCP and their diabetics, and that's showing that they've gotten their A1C tested in the last 6 months. Diabetes control, we're at 61.45%, and those are going to capture those that have an A1C less than 8 on that diabetic testing. And then the last column being hypertension control. So those PCP attributed that have a blood pressure less than 140/90, and we were at 80.6% for the month, or sorry, for the year to date. The next couple slides just going to trend out the previous total clinic visits and the non-face-to-face encounters. You know, I made a note there at the bottom, the virtual first approach that you guys can see due to the coronavirus pandemic. So March and April we're running, you see that steady decline with March and April there. And then you see we're up for March, and then still up a little bit from January and February for those non-face-to-face encounters with that direct member outreach that we're completing. The summary slide here, so if you look at April 2020, we had 449 unique members. That means 449 different individuals completed a visit within our 3 centers. We had total operating costs at $212,391. Employee count, including retirees, last month for the month of April was 6,241 for a PEPM of $34. And then my last slide here, I just wanted to do a did you know and remind everyone as organized sports are opening back up, and we've already started to see an increase in requests for sports physicals at all 3 of our centers. So just wanted to remind everybody that we are doing sports physicals at the 3 centers, and obviously those cannot be done virtually and they have to present to the center, but a $0 copay, and if they just want to call the center, we can get them scheduled and get them in as soon as possible, usually within the same day. Any questions? All right, Mayor, that concludes my report.
Thank you, Ms. McNair. Thank you so much. Next, we have a clinical transition update from Christy Martin. Christy, are you with us?
I saw her on there earlier, Mayor Ketron.
All right. Can you hear me now?
Yes, we got you.
We got you now.
I apologize. I'm not used to the Zoom platform. Sorry about that. No, thank you for having me today. Just wanted to give a brief update on where we are with our transition plan for the MedPoint Clinic. You'll see on your screen we have identified the hours of operation. There are a few changes I can speak to, and then you'll also see we've moved on to New Salem from Blackman. So Stewart's Creek, we're actually proposing no change in the hours there, being open from 7 a.m. to 6 p.m. Walter Hill, we actually made an extension of hours offered there. So they will be from 7 to 4 Monday through Thursday, 7 to 4 Friday, but we will close on Saturday. So we extended some weekday hours, but closed on Saturday. And then you'll see New Salem. We really expect utilization to increase at that site given the new facility. We'll operate there 7 to 6, Monday through Friday, and then we're offering a 8 to 5 on a Saturday. So wanted to share that with you all. You'll see a comparison down at the bottom of the current total hours available today and the proposed hours, as well as provider hours available and proposed. So we're looking to increase 4 hours within all 3 sites of care. Staffing variance, we actually have tweaked based on what we've learned about the sites and the utilization as we've taken on this transition, and we are 16.15 total FTEs is what we're planning for, and we were budgeted for 16.34, and we are good to budget. So we feel like things are on course, moving in the right direction, but wanted to just bring that forward, share that with you. And then also wanted to let you know our plans for opening the practices. We would like the group to consider some type of ribbon cutting or event to really rebrand these practices. So wanted to share that with you and get your thoughts there.
Christy, I think that's a great idea to target that. Can you remind me again, what's our target date for opening?
Our target date is September 1st.
September 1. Mm-hmm. That'd be a go-live date, right?
Yes, that's correct.
So you're planning on having a ribbon cutting that day?
Likely, we would like to give it a week or so. Typically, that's
gotcha.
Better. Kind
Get
of
it up and running maybe around the 10th, 7 or 10 days later?
Yes, sir.
Okay. Any questions for Ms. Martin? Well, sounds like from what I understand, talking to Mr. Elam, you all have been working very diligently and had a great team to work with, and several people on that team trying to pull all this together for us. So we certainly appreciate that, and we also look forward to it.
Well, thank you. Likewise.
Okay, thank you. Item number 9, members, is the County Commission meeting on 5/14. Mr. Elam.
Yes, sir, Mayor Ketron. I was just trying to give an update of the items that the County Commission does. Sometimes the Insurance Committee refers something to the County Commission and the County Commission votes. So I'm trying to put in the agenda each month to come back and communicate to the committee what the results were. So as far as the County Commission on the life and disability, short-term and long-term disability rates, they approved that. On the wellness points, they also approved the recommendation from the committee to suspend those for this year. And then the Budget Committee looked at the Embark, and they decided not to do the Embark program. Let me make sure everybody understands. We're already it's the risk of the Embark, whether or not you pay Cigna and whether you take that risk on yourself in your medical plan, and the Budget Committee decided that they would just assume that risk themselves. And, Mayor Ketron, you may want to expound on that a little bit yourself.
Well, of course, it passed here in this committee, but then when it got to the County Commission and its wisdom chose to take a little bit more conservative side and take the gamble that it wasn't going to happen for either one of those two types of illnesses that would have to be paid for, and thought that if it didn't happen, because there wasn't, I talked to some of the commissioners that they just didn't feel like that there was sufficient data to make an educated decision based on, I think there was mentioned maybe one case, possibly 2 in Shelby County, but they were not Cigna patients. So once that data could be refined, I think they would have been more comfortable with it, but at this point in time they chose not to go with it. And also didn't want to put that burden back on the ratepayers, which are our employees. They too did not know what was going to happen to our budget, with having to make cuts, not give employees pay raises this year because of the downturn in the economy because of COVID-19. So they didn't want to put an extra burden. You know, another $15, $20 a month would make a difference in some people. So that was what I gathered from the commission and why some voted against. Any questions? Hearing none, we'll move on to item number 10. Mr. Huffman, Amada numbers update.
Okay, let me share my screen.
We're good.
And how about
your face
that
was
one?
good.
All right, can you see a grid up there that shows Omada by month, January through February?
No, I just got your beard.
Let me share it again. Here we go. Let me know when that
We got it.
shows up.
We're clear.
Okay. Yeah, my coronavirus beard, right. As you know, we installed the diabetes prevention program in January in collaboration with Omada. And from that outreach and that campaign to drive enrollment, Omada sends the Risk Management Office an update at the beginning of each month as to who has applied, who was accepted, and who was enrolled into the program. So Mr. Elam asked me to just give a quick showing of that so that you can see the numbers that have enrolled through the first 4 months. And as you can see there, through April, we have about 300, a little over 300 that applied, 50 that were rejected either due to didn't qualify or perhaps they already have diabetes. 258 were accepted, met the qualifications, and then 218 followed through and actually signed up, filled in their information, and enrolled in the program. So in discussing that with Omada, they feel that this was a very good uptake for the very beginning based on the campaign approach that we took and how the outreach was developed. And so we do anticipate that those numbers will increase. And then, of course, to get to where we really want to be, 300 or 400 enrolled, we'll probably take another kind of refresh campaign or education to kind of drive that again. And we've made a lot of different avenues for that available, whether it's email, we can look at texting, we can do meetings, we could do incentives if that's desired to try to drive that participation. But just wanted to give you that update. Is there any questions from the Omada enrollment summary?
Any questions? Any questions for Mr. Huffman?
Mayor Ketchum?
Yes?
This is Ed.
Yes, sir.
A couple of things. The reason why I wanted to bring this to the committee to make them aware of, and Paul, you might expound on this a little bit when I get through, is that, this is more of a pre-diabetes program trying to help people before, it gets to that. Me personally, I would love to see those numbers higher than what they are. One of the things that we've looked at is maybe, and this is why I've brought it ahead, and when Paul was talking about incentives, is maybe adding this to our points a little bit later on. And I just want to present this to the committee now that we've had about 4 months of data here to look at, and maybe come back to the committee next month or two and have something to say, whether or not we add this to our points. We can email, we can do a lot of incentive things, and try to boost this a little bit more. But I think our return on our investment, if we get people in this program, we're going to see a good return on the investment, and we'll have healthier employees because of it. So I just wanted to make the committee aware of it. We're going to continue to have meetings on it and discuss, the viability of adding it to our points. And, right now I'm leaning towards to that being a recommendation. I'm just not ready yet because I don't feel like there's enough data yet, but we need some type of incentive to boost this a little bit more. And I think it would if we did it on our Motivate Me points.
That's a good point.
Paul, would you agree?
Yes. In fact, that's consistent with some of the recommendations that we would make. And just so you know, in addition to making available an incentive to participate with OMATA, we would also connect that or tie that with an incentive for those who aren't eligible for OMATA to also receive points through coaching, so that everyone kind of has the same opportunity to achieve the same incentives.
Right. If they didn't qualify, like if they were already determined to be a diabetic or something, then the coaching that they would get. I mean, that's
Right.
just one of the things, I just tell the committee, one of the things that we're talking about and meeting about right now is to, try to find some better ways to help our members be healthier.
Any other questions?
Mayor Ketchum, this is Jeff Phillips. I'm sorry I'm late.
Oh, that's okay.
I had an issue with logging in. My laptop is older than I am, and sometimes I have an issue. Anyway, is it proper for some type of a motion to add that to our incentive plan? Is that proper at this time?
Ed?
Well, what I will say is our intentions is to look at several different things and revamp the whole plan. And this was just one of them. I just wanted to, to kind of bring it to everybody's attention. I anticipate at our next meeting, maybe coming back and evaluating the entire point system instead of, one at a time. But, I just was looking for your feedback. I mean, I assume, with your comment that you would definitely want to consider that.
I just think it's a benefit to employees, and I'd like to see it be not only successful, but very successful too. Well, long term, it would help both the employer and the employee. So I would just like to see it be successful, and whatever it's going to take to maybe get that point across. So we'll just wait and let you report back some more.
Okay, we'll wait till next month so we can, Mr. Elam can bring us all the proposals at that point in time, if that's okay. Mr. Huffman, we'll move to item number 11, Sigma Cap Report.
Okay. I'll share that also. Let me know when you see that.
We've got it.
Okay. Mr. Elam asked me to give a quick, brief overview or summary of a recent meeting we had. As you know, annually, we bring in our informatics team and our clinical team, our doctors and nurses, to meet with Mr. Elam and his team to go through kind of the utilization summary year over year that we've seen with Rutherford County and do basically a consultative analytics total insight review. It takes us a couple of hours. We have probably 50 slides that we go through. So I'm going to just walk through two of those slides that summarize the medical, pharmacy, and the dental as a year-over-year analysis and a trend average. If you look at this page, this is the executive summary for medical and pharmacy. And you'll see at the very bottom left that this represents the calendar year 2019, which is called the current period. And then the base period is the 2018 calendar year. So you'll see that throughout. Looking at the top right of this exhibit, we kind of highlight the total plan spend. So everything that both the county and the membership spent on claims, medical and pharmacy, represented on average about $5,656 per member per year. And that was roughly 6.7% higher than 2018, which is a very good number as far as trend goes year after year. As you know, exponential trend percentage each year is to keep that in the single digits and below 5 or below 7% is going to be our goal. The other thing that we pointed out is that over to the right there a little bit, it says variance from norm. The normative that we're comparing against is our Cigna book of business for municipality clients, government entities that we have across our book of business. We have approximately somewhere around 1 million customers, members in that category. And your current claim cost of $56.56 is about 22% less than what we see across our book of business. So your plan is running very well from a total cost perspective. Your trend is running well. And if you move to the next line, the total employer paid trend, so this breaks out what you as the county paid through claims, increased only 7.3% from 2018. And that's consistent with what Mercer presented to you recently when you were doing the rate setting for 2021. As you move down that grid, you can see the members paid about $734 per member per year on average. And that was only a 2.9% increase over what they paid last year, okay? And we then continue to break that down into medical and pharmacy that you can see in the next couple of boxes, also remaining in that 5, 6, 7% trend range, which is very favorable. So as we move down, I'm sorry, skip the page. As we move down to the bottom right section of this page, a couple of highlights that I'll point out just so you're aware, and we have other pages that drill down in each of these categories. We look at the percentage of your population that has a chronic condition, diabetes, asthma, cardiac issues, COPD, low back pain, anything that has a chronic condition that individuals are dealing with. We see that about 41% of your population is dealing with a chronic condition. They are responsible for almost 72% of your total cost. So knowing that, we spend a lot of time talking about what Cigna is doing to help engage individuals with various programs that we have in place to help them with their chronic condition, to help them with their diabetes, to help them with their asthma, their cardiac issues and things of that nature. Then we look to see how engaged is your total population. Are they engaged in health maintenance activities for their chronic conditions? Are they engaged in prevention and things of that nature? So we're seeing about 55% of your population in total engagement doing something to either maintain or improve their health. That's a little bit of a drop from last year. It's still significantly higher than a norm. So for municipality clients, you're doing very well, which goes to show you that the communication, the education, the information that you're getting to your employees is working and is getting them to participate in a lot of programs. The next one is the preventive care utilization. We're seeing pretty good statistic there. About 54% of your entire population is receiving some type of preventive care utilization. That's a little bit higher than our norm, which is good, and also an improvement from last year. In those preventive care utilizations, you can see that well visit completion was up a little bit to about 46%. And remember, we're looking at the entire population, all employees, all spouses, all children, looking at that percentage. Moving down, another couple of things I'll highlight so that you have. Another good story is that members are obtaining generics. So this is one of the biggest things you can do to save money in pharmacy, and we're seeing about a 91% generic dispensing rate. And for every 1% you improve by, you're saving almost a 1% on your total medical cost. And so you're above the norm from that category. Your generic substitution rate is fantastic. When there's a generic available, they're getting that. And then as you move down, we break out pharmacy into specialty. We've talked a little bit about specialty pharmacy. These are your expensive drugs, things that are made from proteins and things of that nature, things that don't have generic equivalents that are used for very specific diseases. We saw an increase in the retail of specialty medications through the pharmacy. We saw a decrease in the specialty pharmacies that were delivered in a medical setting, like infusions and things of that nature. So those both ran very similar to what we're seeing in the market, and your costs for those are well below the norm. So that's another very good sign. Moving over to the left bottom of the screen, the last thing I'll point out is we also look at your catastrophic claimants, so individuals who have had claims over $100,000. As you can see there, we saw just a small increase in the number of claimants who had claims over $100,000 per 1,000 members. For every 1,000 members on your plan, you now had 5 of those that would exceed $100,000. However, that's much less than what we see on our book of business, and the cost per catastrophic claimant is also less. So that's only representing about $1,100 for all your total members per year. Network penetration, that's the percentage of your claims that occur inside the network, our Open Access Plus network, and your members are obviously utilizing the network in a very wise way at 97%. I will move to the dental page, but I'll stop there if there's any questions regarding medical and just kind of a quick overview of the year over year.
Paul, this is Jeff Phillips.
Yes, sir.
Are those statistics kind of, do they tell the true story as it relates to the type of employees that are being checked? Are these just any employer, or are they more of the factory related or office clerical administrative related? Are we comparing kind of apples and apples there?
Yes, the normative that we are using specifically for this report is used strictly municipality clients of Cigna's. So government clients that we have, just like our Rutherford County, Metro Nashville Public Schools, Metro Government, Wilson County, those kinds, throughout our nation, we put into, and we only are comparing you to those groups.
Oh, they're almost identical. Very good.
Correct.
Thank you.
Yes, you're welcome.
Oh, this is Rhonda Allen. I have a question.
Yes.
The gaps in care rule compliance, what is that? I don't know what that is.
Yes, I'll try to explain that real quick. I know I didn't mention that. When individuals have chronic conditions, there are evidence-based guidelines that individuals should adhere to when taking care of themselves with a chronic condition. And we look to see if individuals are actually doing those things. Diabetes is probably the main one. It has about 50 things an individual who has diabetes has to do throughout the year, have various checkups, feet checkups, retinal eye exams, checking their A1Cs periodically. So we're looking to see if there are gaps, if there are missing claims or missing prescriptions or missing codes for those individuals, and we call that a gap. When we see a gap, we send a letter to the member and to their doctor that says, we see a gap. It may or may not be there, but we want you to be aware of it in case it's something you have forgotten to do or you need to be educated on. And we're seeing that our gaps in care rule compliance for Rutherford County is about 80%, which is pretty good. We never see anyone at 100%, and it's better than our norm. And then we also, in other pages that we look at, we see how did our communication, those letters that we send, how did they impact those rule compliance? And a lot of times we'll see that we helped close that gap and help that individual get the information, because as soon as the letter went out, we see that something was done.
Very good. Thank you.
You're welcome. Okay. If there's no more questions, I'm going to move to the dental slide. And let's see, am I still sharing my screen?
No, not yet.
Okay, let me do that again.
We got it.
Okay, thank you. Again, this is a quick one-page summary of dental, and Mr. Elam asked me to share this with you. We don't always talk about dental. It kind of gets forgotten, but we did want to show you what 2019 versus 2018 looked like, and there are three basic categories here. Just your member population. We do see that this was the first year in 2019 that we had the dental HMO, or Cigna Dental Care HMO. And down at the bottom left, you'll see we had about 782 participants meaning members, total members, enroll in the dental HMO, and that they moved from the dental PPO over to the dental HMO. And that's why you see the reduction in membership on the dental PPO of 4.7%. So as we get more data on the dental HMO next year, we'll have a comparison on that. Moving to the middle, this compares your overall dental health behavior. And what we see is, in the norm for our clients, about 61% of members usually receive a cleaning during the year. For Rutherford County, during 2019, about 65% of your members received a dental cleaning. So we've got some pretty good trending going on there. Numbers are a little bit above the norm. Again, we would like to see 100%. Obviously, babies and children under the age are not going to get cleaning, so you're never going to get to 100%. But we want to encourage members to always receive their cleanings every year. And then let's see, whereas I was looking at, if you look at the graph, that kind of shows you're the gray part, so you're a little above the norm in the shaded blue area, and that's members who have one or more cleanings during the year. Moving over to the right, this kind of summarizes the savings and the trend that we see for dental. Your savings is fantastic. So the dental network that we've built in Rutherford County and Murfreesboro is pretty significant, and the members are utilizing in-network dentists for the most part, and are receiving a pretty significant discount when it comes to dental. So they're participating in about 91.6% in-network charges, and of those, they're receiving about almost 36% network discount, which both are significantly above our norm. So we're very pleased with that. We always are looking for opportunity to grow our Cigna Dental network, both in the PPO and the dental HMO. So anytime we receive feedback to reach out to dentists and try to negotiate a contract, we always do. And just share those with us if you need that. The last thing I'll point out on this page is year-over-year trend. Dental, if you see at the bottom right, it says plan paid claims per member per year. And that is about $215.65 per member per year that we pay for dental, or that you pay for dental. And that was approximately 2.9% higher than last year. So Mr. Elam said, we need to share this with the committee so that they understand that dental costs also have, utilization increases. They also have trend and things of that nature. So just be on the lookout that this may at some point in time may impact dental rates, but right now it's running at a very low trend year over year. And that's all I wanted to share with you on that summary, if there's any questions.
Paul, this is Rhonda Allen again. I do have a couple questions.
Yes.
As you were examining the claims utilization, do we ever look at that in terms of demographics and examine dependent versus employee utilization, retiree versus active? Because I know we're currently using a blended rate, and so I'm just curious, do we ever examine this to see actually a little bit deeper regarding utilization?
We actually do, yes. That's part of our full-blown analysis, and we do have exhibits that break out the employee versus the spouse versus the dependent, and then we also break all the costs out based on just the active population versus the under 65 retiree population and the over 65 retiree population. So all of that analysis is also provided. It's just not in this summary.
Okay, and then that also helps drive some of your recommendations regarding programs and things like that.
Correct. And then that's shared with Mercer so they understand, but they're also doing the analysis of claims on those same categories as well. We looked at that a couple of years ago when the spousal exclusion was being kicked around and when that decision was being made. So we did identify the spousal costs and things of that nature. So we can always share that information with anyone who needs it.
Yeah, that's actually the reason that question came to mind, because that stayed with me. That when we made that, when we made that decision, it was because the spouses had a higher utilization rate than our employees did, and so that's and so then that leads to my second question, which might be for you, might be for Ed, and that is, when will we conduct a dependent audit again?
Yeah, that would be an Ed question.
Have we done one lately? No, not since the last one that was done before me. I won't say with what we've got on our plate right now that we've really looked into that. But I mean, it's something to be considered.
Very good. Thank you.
Thank you.
Are there other questions for Mr. Huffman? Any other questions? Thank you, Paul.
Thank you, Mayor.
Next, members, we have item 12, property and casualty quote from Mr. Patterson, our broker. Mr. Patterson.
Thank you, Mayor Ketron. You guys hear me okay?
We are.
I'm going to try to share my screen with you. Can you guys see the information there?
Yes.
Good.
Yes, sir.
So effectively, everything is pretty well the same coverage-wise this year, this upcoming year, as opposed to the expiring policy year. As I go through this, I don't want to necessarily get into the weeds with you guys unless you want me to. I'd be happy to. I mean, insurance is my life. I love talking about it. Of significance, property values are up about 66 million, almost 67 million year over year, which is, of course, driving premium increase. In addition, on the property rates have increased. The other lines not as much, but industry-wide property rates are definitely on the increase, and that's being driven by catastrophic claims across the country. Not just hurricanes anymore. Now, with changing weather patterns, we're having a lot of supercell storms, tornadoes like we had in Nashville, super hailstorms in the Midwest and even in Indiana and places like that where they never used to happen before. So those types of things are driving rate increases. And of course, Rutherford County is growing significantly, so we've got higher property values. So hopefully you guys had a chance to kind of look this over. I don't know if you have any specific questions. At the very bottom of the footnote here, you'll see that 66.6 million increase in just pure property values on the property side. Then on the casualty side, we've got, I think, 20-something more additional vehicles that we're insuring, which is, of course, more physical damage. All the automobiles are insured on replacement costs. So if you have a 8 or 9 year old Ford Taurus or whatever, if we total it, we're going to get a brand new Ford Taurus. So we have to insure those to replacement costs.
David, I got a question on the automobiles. Are you adequately, do you remember seeing deletions when we send things from our department? We surplus several vehicles per month. Are you getting those to delete them off the policy in a timely manner?
Yes, sir. Yeah, so one of the great things about the way we've structured the property policy, and particularly since you guys are in growth mode, if we add vehicles or changes in the vehicles, doesn't really generate premium throughout the course of the year. To answer your question, yes, we keep up with that, but only once a year do we actually have a premium event, and that would be on renewal, if that makes sense. So even though we added, I think the net change was 26 vehicles over the course of the year, additions and deletions, a net increase of 26, there was actually no premium change during the course of the year.
Okay.
We don't realize that until renewal.
David, this is Rhonda Allen. I have a question.
Mm-hmm.
When we moved to the leasing vehicles, did that make any change or any impact? I don't know the contract well enough to know who's responsible for what in terms of auto damage. So,
no, ma'am. So I think we're still, excuse me, I'm sorry, go ahead.
I'm going to say, so leasing versus owning doesn't change our premium?
No, ma'am. So we're still responsible for the physical damage of the auto, whether we own it or lease it. So we're insuring it for replacement costs, which is great from a lease standpoint because I think it was Enterprise that we're leasing from. If we tear up one of their vehicles, they want enough money to replace the vehicle. And we don't want any gap between actual cash value and actual replacement cost of the vehicle. So that's another benefit of insuring that replacement cost.
Great, thank you.
Mm-hmm.
David, another question. Have you had a chance to go in last year? When we were looking at the volunteer fire departments, we discovered, or you discovered when you were reviewing their policies, we had some buildings double insured. We had them insured that we own, like Kittrell, we own the building. They also had them insured. And I think there was double insurance on several vehicles. Have we ferreted that out?
We ferreted it out. We've identified everything, and of course there were a lot of conversations, sir, as you recall, over the course of the year about the volunteer fire departments and how the insurance is going to be handled. And I think at the end of the day, the decision was made just to kind of leave it alone. It was too complicated. But to my knowledge, we're insuring, or they're insuring, 3 county buildings that we are also insuring, and I think 8 fire trucks. The county owns these buildings and fire trucks. So they're on our schedules, and they're on their schedules as well. So a decision just needs to be made on who's going to insure the things.
Well, I would like for us to discuss that at the next meeting if we possibly can. We'll put that on the agenda. I guess it was probably fortunate on behalf of the county's perspective, the windstorm that took the roof off recently at Kittrell. We owned the building, but it was one of those that was double insured. And since we carry a $100,000 deductible, I think their insurance was primary and ours was secondary. Is that correct?
That's correct.
Okay, and they carry a much lower deductible, so we didn't have to come up with $100,000 on that case, so we were lucked out on that one, I believe. But we probably do need at some point in time, especially my more concern is from a liability standpoint on the automobiles and the fire trucks.
That's probably where the catastrophic claims could come from, I guess.
Yeah, if we can, and maybe discuss that in more detail next month.
Okay.
Are there any questions for Mr. Patterson?
On the, and then the other, I'm sorry. Then there's a couple more slides. The cyber liability is exactly the same. We added that coverage last year, you guys might recall. Then we've got dental, oops, a little too fast, dental professional, which covers the dental operation in the health clinic.
You want to click, do you have those slides?
Yeah, is it not showing up?
No, sir.
Oh. There it is.
We got it.
Okay. So here's the cyber liability, which is the coverage we added last year. And it's the exact same coverage this year.
And prior to you taking over, we actually had much less coverage in cyber, which was a concern of mine, that we weren't adequately covered for cyber.
Yes, sir. There was actually no coverage.
Okay.
That was something I identified as a need.
As our new IT director, we seem to be getting, there are more and more hacks going on with governments. Just want to make sure that we had some greater coverage than what we had. You never know how much is going to be enough. And
As I'd like to say,
if we do get hacked, would Assured
insurance to buy.
If we get hacked, would Assured Partners pay in Bitcoin?
Well, as a matter of fact, I'm not sure it'll be Assured Partners, but yeah, they actually will. So there's extortion coverage that's a part of the cyber liability, and of course, the extortionists all want to get paid in Bitcoin because it's not trackable, and they actually will pay that in Bitcoin.
Okay, if we get held ransom. Okay.
Ransom, yeah, because that's really, there's a big move in the way claims are shaking out now on the cyber side. It's all ransomware, social engineering type claims now. Nobody's really going after people's personally protected information because you have to try to sell that. The easy money is taking over the county's computer system and saying, give me $50,000 in Bitcoin or you're never getting your data back. That's
Right.
the easy money, and that's the way things are going these days.
The city of New Orleans was held ransom sometime this past year for quite a length of time, and trying to figure out how much they were going to have to pay.
Right. Yeah, even in small towns as well. I mean,
Yeah.
there was a small town, I can't recall the name of it now, in Alabama, that was hacked, and they didn't have any money. They was like, we don't have any money to pay you. And I don't even know how that resolved, but educational institutions and municipalities, public entities are definitely targets.
Okay.
So the dental professional, again, that covers, could you guys still see my screen?
Yes.
So the dental professional covers Dr. Bhakta and his assistant in the health clinic. That's exactly the same as last year. And then we have another thing we might discuss, sir, is the Volunteer Firefighters Association. Through that whole process of talking to the VFDs over the year, this is also duplicate coverage. So each one of those volunteer fire departments has similar coverage. Some of them are as good, some of them aren't as good, because each one does their own thing. But this is actually duplicate coverage. And I'm not sure if that was supposed to cover all the VFDs or if we're just supposed to be covering the county rescue. That's something we need to talk about, because it's covering everybody at this point, all the VFDs.
Okay.
And that's really the bulk of it. Everything is pretty much the same. I mean, of course, the county's growing. You guys have increased population on a screen, a couple of screens up. I had it, here it is. So the auto, if I could stop, the auto fleet is up 26 units net. Payroll's up 17 million. Population's increased 52 million. So the county's growing. These are great things, but of course that translates in more exposure and more premiums.
Mr. Patterson, this is Lois Miller. I have a question, and forgive me if I'm just not seeing it here on these exhibits, but what is the net increase for the total?
I actually have that. Yeah, Ed said, you didn't put that in there, and I was like, oh my gosh, I forgot. So last year the total's 1643, and this year the total is 1828. And the majority of that is in property. Property increase was probably 150,000 of that. Everything else is
roughly a 10% increase year over year?
Roughly. I think it's almost 10%.
Lisa Nolan, you still on?
Yes, sir.
Last night at budget, did we not, with anticipation of this meeting today, we went ahead and acted the increase?
That's true. We went ahead. Dave Patterson was able to give me the split by funds, and that's what I was using yesterday to adjust the school board's budget and for the counties.
So would it be proper for this committee to go ahead and vote on it even though we took action last night? Just for the record?
I mean, I think you should. That was, for me, it was just a budget number.
Water infrastructure.
Mr. Elam?
$105 billion by 2025.
Mr. Elam?
Mayor Ketron?
Yes.
Yes, we do need a vote on this, and as Lisa said, we've provided these numbers to them from just a budgeting standpoint, but this will have to go to the Budget Committee and the full board for approval.
$1.87 trillion in lost business sales, 700,000.
Okay.
This is Lois Miller. Can I ask just a couple more questions?
Sure, Lois.
When we're looking at this, can we,
Our first poll.
Mr. Patterson, can you tell us what the average increase your other municipal entities are seeing?
A lot of it's claims driven, so I'm going to say that it's pretty comparable. The property increases are slightly higher than what we're getting for you guys because our claims experience has been excellent. Some of my municipalities have had more claims, and they're seeing 20 to 25% rate increases on their property. Casualty is staying pretty level. Our casualty increase of all of that was year over year was about 3%. So that's not bad given our exposure increases. It's property that's really driving all of this right now.
So it's primarily driven by losses and growth in the county on the property side?
Correct.
Okay, thank you.
And about
So
well,
David,
the county's had great, so losses are driving industry-wide rate increases.
Right.
And so the county's had great loss experience on the property side. So that's not, your losses are not driving the premium. Your growth is driving the premium.
Okay, thank you.
David, I'd recently read just in the last week or two that the markets in the industry nationwide were probably, they're trying to forecast out, and probably the rates are going to start to harden as we turn into a harder market than what we've been used to.
Yes, that's absolutely true. And it started probably 18 months ago to 24 months ago, sir, on auto, which was a little surprised that your casualty wasn't a more significant increase just because of auto. But then property quickly followed it. And now the concern with COVID is that the management liability, the directors and officers, the professional liability type things, if there a lot of claims start coming from COVID, it's going to drive that. But we're just going to have to wait and see how that mess shakes out.
Right. Any other questions for Mr. Patterson? So, Mr. Elam, you want to tell us exactly what the motion should read?
Yes, sir. It would read something similar to this, that we accept APIP on the property, Brett on the casualty, APIP on cyber liability, Admiral on the dental, and Axis on the volunteer, as presented.
Chair will entertain a motion for that
I'll put that
motion.
in form of a motion, Mr. Mayor. Jeff Phillips.
Jeff Phillips made a motion. Is there a second?
This is Lois. I'll second.
Second from Lois. Now, any questions? No questions? Seeing or hearing none, Madam Secretary, if you would please call the roll.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Alan Farley.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Eric Tutobeni.
Yes.
Shante Sherrill. Shante Sherrill.
Yes.
Mayor.
Aye.
That's unanimous.
We have unanimous on the vote. Ms. Corbin, thank you for filling in today.
Thank you, sir.
Did a good job. Is there any other business to come before the committee today? Seeing none, is there a motion to adjourn?
So moved.
Got a motion?
Second.
And a second. We stand adjourned. Thank you so much for